Hi, good afternoon. My name is Joanne Conroy, and I'm President and CEO of Dartmouth-Hitchcock, Dartmouth-Hitchcock Health. And thank you for joining me for our segment, Connect with the CEO. And I am thrilled to have today Dr. Gary Schwartz, who's medical oncologist and interim section chief of medical oncology here at Dartmouth-Hitchcock. Welcome, Dr. Schwartz.
Thank you for having me, Dr. Conroy.
This is a really important segment for us. We are talking about vaccinations and the confluence of the concerns that may arise if you're also under treatment for cancer or a cancer survivor. Dr. Schwartz is eminently qualified to answer a lot of these questions. He's the 2021 Top Doc by New Hampshire Magazine, and has been involved for years at Dartmouth-Hitchcock and Dartmouth-Hitchcock's Norris Cotton Cancer Center. Tell us a little bit about when you arrived here, and maybe talk a little bit about the growth of oncology here over your tenure.
Yeah, so this was a very small, it's been a very small cancer center, and when I arrived 20 years ago, I remember everyone's office was on the third floor of the cancer center building, and we were all crammed together in a space right next to the clinic, so you could walk 20 feet to get from your office to the patient room or to the infusion clinic. And over the last 20 years, we've just seen a huge expansion of the space so that we now have, 6 floors of the Rubin building, and our offices are scattered all over the Rubin building. So just in terms of the space, it's been an enormous expansion, and we have a lot more people now here than we did back 20 years ago as well. So it's still, in relative terms, a very small cancer center, but it's quite a bit larger than when I arrived 20 years ago.
Yeah. It's interesting, they take outstanding care of patients, and I know Steve Leach, who's the center director, was thrilled when we were ranked as the top in the country in terms of patient experience around cancer care, which is really very affirming. Now, what is your specialty?
So I work in the area of breast cancer, and I'm a medical oncologist.
A lot of questions we have about survivors and people undergoing treatment, but writ large, as we're kind of facing the pandemic, are people that have had cancer or are undergoing treatment for cancer, are they at greater risk for getting COVID?
Yeah, it's clear that people who've had a cancer diagnosis recently are at a substantially increased risk of getting sick or dying from COVID-related illness. It's not really clear why that is. There are a lot of risk factors for cancer that are also risk factors for critical illness from COVID, including older age, obesity, cigarette smoking, liver disease. Part of it might be the effects of treatment, although it doesn't appear that chemotherapy or treatment for cancer actually increases your risk of getting critically ill or dying from COVID. It may be underlying abnormalities of the lung. So again, we know that lung cancer patients are at a significantly greater risk of dying from COVID than other people with cancer. And it may be that there may be defects in the underlying immune system. So we know that people with hematologic malignancies, such as leukemia or lymphoma, are also at a significantly increased risk of getting sick or dying from COVID illness than other people with cancer.
So my sister is a breast cancer survivor. She had cancer, I think, almost 8 years ago. My expectation is she did a lot of research. She works for a medical research company in Minneapolis. My expectation is a lot of your patients called you and asked for your advice on whether or not they should get the vaccine. So what type of advice are you giving them?
Yes, I tell everyone who asks, and even people who don't ask, that they should go out and try to get vaccinated, and they should get vaccinated sooner rather than later.
I think a lot of people worry that they're immunosuppressed and that a lot of the initial trials actually didn't deal with people that were immunosuppressed. So tell us a little bit about how you talk people through that, because the vaccines actually do depend on an immune system to develop a response. So how does that work?
True. So there's two factors in the efficacy of a vaccine or any other drug, and that's safety and efficacy. And as you said, the three vaccines that are currently approved by emergency use authorizations did not enroll patients with active cancer on treatment. So we don't have any direct evidence from the vaccine trials as to the safety and efficacy of these vaccines in people being treated for cancer. So you actually have to extrapolate from our experience with vaccination for another very common viral illness that has a lot of the same characteristics as COVID, namely influenza. So we've been vaccinating people for influenza for years and years. We have a lot of data on the safety and the side effects of influenza vaccine in people with cancer. And so a lot of what we started telling people about what to expect from COVID vaccination is based on our experience with influenza vaccination. So with regards to safety of COVID vaccination, again, there's been a lot of concern about some of the therapies for cancer, particularly the immunotherapies, the drug treatment which stimulates the immune system to react against the patient's cancer. And there was a lot of concern that these immunotherapies might actually allow more inflammation, more of the sort of cytokine storm to occur after an active COVID infection. And in fact, there was some concern that there might be more immune reaction against perhaps lung tissue in people who get a normal COVID vaccine. None of this was the case in the setting of influenza vaccination, so we didn't see any effect of the immunotherapy on the side effects of influenza vaccination. There's a society of clinical immunologists who treat cancer with immunotherapy drugs, and they came out in a position statement back in December saying that they thought that people should continue to get their immunotherapy for cancer at the same time that they're getting their COVID vaccination, and that people on immunotherapy for cancer were not at an increased risk of developing side effects from COVID vaccination.
Now, do your patients call you if they get what falls into the normal side effects of the vaccine? And do we see any more of that? So the things that we've heard from our own staff have been, some people have been fatigued, some people have had some myalgias, we've had a few people with fevers. The majority of people, though, have had no impact at all from the 2 doses that they've had of the currently available medications.
Yeah, so people sometimes call, but I always ask them right after when I see them right after their vaccination to determine if they've had any side effects. And I haven't noted any unusual pattern of side effects in people getting COVID vaccination. I haven't seen anyone yet who's had symptoms more than 2 or 3 days. And in general, the symptoms have been relatively mild and limited to about a day.
Yeah. On the flip side, do we have any idea whether or not patients either or are undergoing some type of immunotherapy or have a compromised immune system from cancer, whether or not they mount a significant antibody response? Is anybody studying that right now?
Sure, that's a great question. I don't know for a fact if that's being studied by any of the 3 manufacturers so far. Again, I have to go back to the influenza vaccine studies in people with cancer to be able to answer the question about how effective vaccination is in the setting of being on cancer chemotherapy. So we know that cancer chemotherapy of a variety of different sorts makes influenza vaccination a little bit less effective. Now you have to remember that the influenza vaccines are often not very well matched to the year's outbreak of influenza, and so influenza vaccines are commonly have efficacy rates of under 50%. And we've seen arguments over the past month that we have 2 vaccines with efficacy over 90% and 1 vaccine whose efficacy is in the high 70s, and is there a significant difference between that? But again, compare that to influenza. These vaccines are all much more highly effective than the average influenza vaccine is. So even if there is a tail off in the efficacy of these vaccines in people getting cancer chemotherapy or in other therapy that sort of suppresses the ability of the immune system to make antibodies, I still think that there is still going to be a benefit for people to get vaccinated. So I really urge anyone with cancer, anyone on cancer chemotherapy, to please go out there and get vaccinated. By the same token, admittedly, these vaccines may be a little less effective in people who are on chemotherapy, and particularly people getting more intensive therapy for some of the hematologic malignancies. So for those people, I urge their families and their friends and any contacts, for anyone who has a person with cancer in their life, please get vaccinated. You're not only doing that for yourself, you're also helping your colleagues, your friends, your family, and even strangers walking down the street. There are an enormous number of people you help by getting vaccinated.
Yeah, that's actually great advice. And for cancer survivors that I know and people undergoing current treatment, they are very, very diligent, I think, about really making sure that their bubble is as safe and secure as possible, their bubble of friends. Now, there may be some people who are getting ready to start chemotherapy. What's the best timing? Because do we advise them to get vaccinated before they start their chemotherapy? But because most of the medications are 2 doses, it's going to be in the middle of their chemotherapy anyway, it appears. So how would you advise them?
Yeah, this is often threading the needle for us. So we're trying to get people vaccinated as quickly as possible, and yet we have to keep the chemotherapy on schedule. So I have one patient, for example, who was vaccinated with his second dose of vaccine the day before I saw him. And he needed to start chemotherapy within a couple weeks, so I delayed the start of the chemotherapy for exactly 2 weeks until the end of the 6-week interval since his surgery, so that I would give him the maximal amount of time possible to mount an immune response to the second vaccine before starting chemotherapy. Very often we don't really have that flexibility in our treatment schedules. So we're trying to accomplish 2 things. We're trying to treat and manage aggressive malignancies, and we're trying to protect people from COVID, and so we do the best we can. Sometimes if someone is in the middle of a course of chemotherapy, we'll recommend that they get chemotherapy on the 4th or the 5th, that they get their vaccine on the 4th or 5th day after the chemotherapy administration. That seems to be the ideal time to mount an immune response after getting conventional chemotherapy.
Yeah. I do want to remind viewers that if you have a question for Dr. Schwartz, please comment on this video and they magically kind of show up on my iPad. One thing that I think is actually supporting our recommendations is the new evidence that's come out that said that both Moderna and Pfizer vaccines actually create a significant amount of protection after the first dose, and after 2 doses in the what we call phase 4 trials, so when we actually put it out in the community and continue to monitor the impact, they're just as effective as they were determined to be with the initial clinical trials, and that there's a greater amount of protection maybe than many people think. So that's all good news for our patients.
Yeah, there's an enormous amount of good news coming out about these vaccines, particularly since the mortality rate in vaccinated people appears to be almost 0.
Yeah. We're getting some questions from our audience members. I'm booking a beach vacation soon. I hope they're not going to an international destination. I plan to pack sunscreen to protect against sun exposure to prevent cancer. Should I be wearing a mask on a windy beach to protect from COVID?
It depends how far apart people are going to be on the beach, and it depends how much you can socially distance on the beach. So I think it's always safer to have the mask available in public. If you happen to have a nice secluded spot on the beach, more than 6 feet away from the next people, then by all means you can take off your mask. And on a nice, bright, windy day, you should have very little exposure risk from the virus. But on the other hand, if it's more of a crowded situation, particularly getting in and out of the beach, it would be a good idea to have the mask on you.
Yeah. You know, I think we've all seen pictures of areas of the country that have relaxed a lot of mask restrictions. And it seems like people have embraced this with abandon, and maybe not in all the good ways that you embrace something with abandon. There have been a number of pictures of packed restaurants and packed bars that probably not the best place for any patient to go to, but certainly patients that are survivors or undergoing current chemotherapy treatment. Can we talk a little bit about mammograms? I know that here, during the peak of the pandemic, our mammography screening dropped off significantly.
Yeah.
And that was incredibly worrisome, both to our oncologists as well as our radiologists, that say that, you know, we pick up women every single day that have early stage changes that need to be investigated further. Where are we now? And how do we counsel people around timing the vaccine with actually getting their screening mammograms?
Yeah, I think that screening is picking up again. I think that over the past year, we've probably been late on a lot of people's screenings. I'm not all that concerned about someone who's been on a regular screening schedule who is 3 or 6 months late for the screening mammogram. I'm not that worried about those people. I'm more worried about people who are reluctant to come in for symptoms, say for a lump or for breast pain, to get evaluated, because I worry about that those people will have their cancers diagnosed at a later stage. So, and I think that plays into the next question is, when are people going to come back to living their lives as normally as possible? We still see a lot of people who are reluctant to come in for doctor's appointments. They may be vaccinated, or they may be recently vaccinated. They've been sheltering in place for a long time, and they may be reluctant to go out in public again. I think that that's just another factor which makes it so important to encourage everyone to get vaccinated, so that we get to the point of herd immunity, so that everyone across our region can feel more comfortable about going to the doctor's office.
Yeah, there's just a certain amount of kind of re-entry anxiety for people that have been sheltering at home. And I remember, you know, the first time I actually went and sat down in a restaurant, which was outdoors, but it was, I hadn't done it for over a year. And I think the questions are, you know, should I be doing this now? And how safe is this? That I think many people struggle with.
Mm-hmm.
Now, are you doing a lot of your visits virtually still?
Yeah, we're doing, across the cancer center, we're doing about 20% of our visits virtually. We've been trying to convince our providers to do more virtual visits. Some people are more comfortable with this than others. We have a lot of patients who don't have the best high-speed internet access, and it's been a struggle for the patients to, you know, get a useful access to the web good enough to be able to do a face-to-face visit. So I think the other thing in the cancer center is that a lot of our visits require blood tests and infusions, and so a lot of the visits need to be in person anyways for drug therapy. So that sort of limits the percentage of patients who can do their visits virtually rather than in person.
Yeah. I think that's a big issue in rural America. You know, we really need much better kind of broadband access. Yeah. And it's actually fascinating that you don't have to go very far outside of Hanover to actually start seeing some diminution of your access to the web. So
yeah, my daughter just moved to Lyme, and she said that Lyme only recently got high-speed internet over the past 2 or 3 months.
Yeah.
So just one suburb away from Hanover.
I know. It's a challenge.
With regards to the mammography question, there's a Society of Breast Imaging that has laid out guidelines that they feel that people should wait at least 4 to 6 weeks after, at least not get vaccinated within 4 to 6 weeks of getting a mammogram. And that's based on theoretical concern that there may be enlarged lymph nodes that appear in the armpit of the arm that gets vaccinated, or lymph nodes above the collarbone. Whether that's appropriate guidance, I'm not sure. I would be comfortable with just a 2-week wait, but still, you are putting yourself at higher risk of getting findings in the armpit if you have a vaccination within 2 weeks of getting a mammogram.
Yeah, I do remember reading some of the initial kind of recommendations that people thought that lymphadenopathy would lead to overdiagnosis. Is anybody studying that to decide whether or not that really occurs?
I think that people are probably studying it, but it's so early yet. And again, we've just been vaccinating the public for the last 3 months so far. So I think it's too early to expect to see any findings from something like that. But I did see a patient of mine within the last 3 weeks who had a mammogram showing enlarged lymph nodes, and it got her a lymph node biopsy, which the pathologist puzzled over for a few minutes before I mentioned to her that the patient had had a vaccination 2 days earlier.
Yeah, so that's a good piece of important information for patients for timing their screening mammograms.
Yeah, and again, if you do get a mammogram in close proximity to a vaccination, please tell your mammographer.
Yeah. Next question. I'm currently undergoing cancer treatment, and my child will be going back to school full time in a few weeks. They are under 16 and won't be vaccinated. Is there risk of exposure I should be concerned about?
Yeah, we don't know very much about that yet. Obviously, it's going to be months before we start vaccinating children yet, until we learn about the safety and the efficacy of these vaccinations in children. I think that it makes sense for every adult with a child at home to get vaccinated if at all possible. But again, the early data that I've read seems to indicate that children are less likely to transmit this virus to adults in the household than, say, older children or other younger adults are. So I don't think that this is a risk-free situation, but you should, if you have small children at home, you should definitely try to get vaccinated.
So the advice is get vaccinated. Make sure your child, if they can, wear a mask and have great hand washing.
Yeah.
And just follow the normal kind of social distancing protocols if you can during your cancer treatment.
Right.
Yeah. Another question from a cancer survivor. I'm a 3-time cancer survivor and have lost an extreme amount of weight. Would it be okay to get my second shot? Sounds like it's a weight loss maybe between the first and second shot.
Yeah. I think that we know that in the vaccine trials that the efficacy goes from 80% after one vaccination to 90+% with the second vaccination. So despite what else is going on with your health or your medical care, please complete the course of vaccination.
Now, they don't modify the dose of the vaccine for weight at all.
Correct.
So there's nothing that she needs to do to inform her providers.
Right.
Here's another question about the pandemic and on the rates of cancer diagnoses, both nationally and here at the Norris Cotton Cancer Center. Are we seeing our diagnoses of new cancers actually going up after a year of people not actually coming to the facility unless they had an urgent medical need?
Yeah, I actually haven't seen the numbers from 2020. I suspect our numbers over the entire year are down a bit based on the fall in our number of patient visits. We've sort of recouped by the fall and the turn of the year in terms of our numbers, but I don't think. But I think that the fall off in our numbers over the spring and summer probably led to a decrease in the number of cases that we diagnosed. I'm not sure what's happened so far in 2021 because it's still very early yet. And it'd be interesting to see, our visit numbers usually go down in January, February, and March because people cocoon during the wintertime. And our numbers really surge up for screening and for routine follow-ups in April, May, and June. So we'll see what our numbers look like in the second quarter of the year.
Yeah. Another question from the audience. How can we make sure that patients are getting diagnosed and receiving treatment as timely as possible? What can we do as a community to actually encourage people to be seen?
Well, I think opportunities like this to let people know that we're open for business and available to see people with hopefully very, very short waits. We're working on improving our access to new patient visits. But again, I would encourage anyone who has a concern to, or who has a cancer diagnosis and wants to come here for treatment, to give us a call, let us know, so that we can come and help and be part of your cancer care team.
I think that it is kind of a time for call to action for a number of screenings that would be otherwise normal in the course of our kind of wellness practices, that people may actually have let slip. I would say that, although I don't know for sure, that probably everybody wasn't thinking about, oh, I need to schedule my colonoscopy during the pandemic, or schedule my screening. What are some other screenings that people really need to attend to over the next year as we actually get people vaccinated and people feel comfortable coming to the institution?
Yeah, again, I think that the screenings that we know are of use to reduce cancer mortality include yearly mammography, yearly CAT scans of the chest for people who are smokers of the appropriate age range, pap smears and pelvic exams, and screening colonoscopies in people at relevant ages and risks. We fell behind a little bit on mammography and colonoscopy, I know. We have capacity to pick up the pace and resume the pace of screening that we were carrying out before the pandemic hit in March of 2020. And again, I'd encourage anyone who is, wants to move on from the pandemic to please get your cancer screening on schedule, just like you've been doing before the pandemic hit. We are open for business. Again, I think that as the pandemic gets under better control, people who are reluctant to go out are going to feel more comfortable about coming to a healthcare facility and getting their cancer screenings done. But that means that we have to work very, very hard to encourage people to get their vaccinations.
I think a lot of women don't know that they can actually self-schedule their screening mammography, that they do not need a physician's prescription, which was required for many years by insurance companies. And in New Hampshire, women can schedule their own screening mammography.
Right, you don't need a doctor's order for that.
Right, you can just call up and make an appointment. Are there any other screenings that people can just do that?
I'm not all that certain how colonoscopies are run. In general, my colonoscopies have always been ordered for me. I have a dermatologist that I see on a regular basis to do skin cancer screening, and that's been part of my regular routine for several years now.
Yeah.
So certainly skin cancer screening, please call for gynecologic exams for women of the appropriate age range. And for colonoscopies, I'm just not quite sure how those get ordered.
Yeah. So it's probably a good time for people to actually call their primary care provider and say, I haven't seen you in a while, and there are many screenings that actually can be ordered kind of ahead of time in preparation for an annual visit. So I want to thank you, Dr. Schwartz, for joining me today. And I want to thank all of our viewers. We have a lot of questions that come in about COVID-19 vaccine, access to the vaccine, questions about side effects. Please check dh.org, and please continue to wear a mask. Book your vaccine as soon as you are eligible, and have a wonderful day. Of note, today is National Doctors Day, so a heartfelt thanks to all of our wonderful Dartmouth-Hitchcock health physicians across the two-state area. Thank you, and see you next time.